Good morning, everyone. Thank you for joining us today. It's a pleasure to be here in the Press Theatre on the traditional territory of the Songhees Nisquamish First Nations. I'm being joined today by Minister Adrian Dix by phone in Vancouver, and Dr. Kim Chi, the Vice President and Chief Medical Officer for BC Cancer. And we're here to talk about an exciting addition to our early cancer diagnosis and treatment programs. At a time when we're dealing with the challenges of COVID-19, it's easy to forget that families right across British Columbia are grappling with cancer diagnosis. Cancer doesn't wait for global pandemics, and we know that early detection saves lives. It means more treatment options, it means faster recovery, it means better outcomes. And that is why Minister Dix and his team have been working with BC Cancer to expand cancer diagnosis programs across British Columbia, including, most recently, the announcement of regional cancer centres at the new Surrey Hospital, as well as the upgrade in Burnaby at the Burnaby Hospital. In addition to that, very exciting in both Kelowna and Victoria at BC Cancer Centres, the expansion in the state-of-the-art PET-CT scanners that mean that people who need these important diagnostic services are not travelling into the Lower Mainland, are able to stay in their region, in their community, to get the diagnosis they need. And to continue on that important work, we're very happy to announce today a new lung cancer screening program, the first in Canada. This program has been needed for a long, long time. 6 British Columbians die each day from lung cancer. It's the most common cause of cancer death in Canada and worldwide. But right now, 70% of all lung cancers are diagnosed in advanced stages. Our new lung cancer screening program will establish clinics right across the province and take advantage of our existing CT technologies. Program development will begin immediately, and the program will be fully operational by the spring of 2022. Once it's up and running, these clinics will see up to 20,000 patients a year. And I want to thank BC Cancer particularly for the work that they've done to continue innovating, continue to give hope to families and individuals right across British Columbia and indeed across Canada because of the groundbreaking work being done in our province. These changes give people hope, give people opportunity to get early treatment because they got early diagnosis. And nothing's more important when you're given the call about cancer to have some hope that that diagnosis has been done early enough so that treatment regimes can be put in place to protect you, to protect your family, and indeed, at the end of the day, to save lives. This is an exciting initiative and one that I'm very, very proud of, and particularly I want to thank Dr. Kim Chi, who will be speaking in a moment, and Minister Dix for being so aggressive on this diagnostic transformation, starting here in British Columbia, and I believe will go right across the country. So I'll pass the microphone over to Minister Dix, somewhere in the Lower Mainland.
Thank you very much, Peter. It's such an honor to do this today. I'm so fired up about the opportunities that working with the exceptional people in our healthcare system provide for everyone in BC. It is this transformation today will literally make the difference in thousands of lives in the coming decades in BC, and it shows British Columbia, BC Cancer leading the way. I want to thank Dr. Kim Chi, his team at BC Cancer, who exemplify, I think, the spirit that everyone in healthcare, the people in the hundreds of thousands who work in healthcare in BC have shown during the COVID-19 pandemic. I want to note, and the Premier has noted this, that about 1 in 2 British Columbians will develop cancer in their lifetime. In 2018, an estimated 28,000 new cancers were diagnosed in BC, and in 10 years, that number will increase dramatically to close to 40,000. Lung, breast, colorectal, and prostate cancer are the most common types of cancer in Canada and account for almost half of cancer cases. More people die of lung cancer than colon, breast, and prostate cancer combined. 3,300 new cases estimated in 2020, 2,500 deaths. And currently, less than 1 in 5 lung cancer patients live 5 or more years. This is heart-wrenching news for families when it comes, but it's also something we can do something about. The goal of lung cancer screening, that the Premier has just announced, is to detect lung cancer at its earliest stages. And it's been estimated through clinical studies that the screening we're talking about can reduce mortality by 20 to 25%. 70% of all lung cancers are diagnosed at an advanced stage, as the Premier said, when symptoms are already present. Early detection will result in improved survival rates. The target population for this new cancer screening program is approximately, in total, 90,000 people in BC. These are adults between the ages of 55 and 74 that currently smoke, have a heavy smoking history, or quit smoking within the past 15 years. Program development will begin immediately, and the program will be fully operational by the spring of 2021. This test, the cancer test, the screening test, is a low-dose CT scan, which takes minutes and is not painful. And our 67 CT scanners, and we'll be building out this network in BC, conduct about 800,000 screens every year. As you know, and as people know, BC currently offers screening programs for breast, cervical, and colon cancers. We have been leaders in the past. Our screening program for cervical cancer dates to the 1950s in BC. We were first in Canada for that. Our breast cancer screening program dates to the 1980s, 1988. We were first in Canada for that. And now we will be first in Canada to have a lung cancer screening program, but I think we will lead the country in that. And I am so proud of our team. I'm confident this will detect cancer early and improve mortality rates. We are fortunate to have strong partnerships in the Canadian Partnership Against Cancer and the BC Cancer Foundation, which is contributing $50,000 in 2020-21, $800,000 in 2021. The BC Cancer Foundation and Sarah Roth and her team just do this exceptional job. And a fundraising target for the lung screening program of about $1 million. I'm happy to say, because of the generosity of British Columbia, they exceeded their fundraising goal by $750,000. They raised a whopping $1.75 million to go towards vital equipment and the startup cost of the lung cancer screening program. Congratulations, and a special shout out, if you can imagine, the Sharon from Kelowna, who raised $1 million all on her own. This lung cancer screening program is one of recent actions the government has taken to invest in early cancer diagnosis and treatment. You spoke of the expansion of investment in BC cancer centres throughout the province with new state-of-the-art PET-CT scanners in Kelowna and Victoria. This is a great day for our program, and we are very, very proud that this will be the first lung cancer screening program in the country. And part of the reason for that is the extraordinary leadership of BC Cancer, of our Chief Medical Officer, our leader of BC Cancer, Dr. Kim Lin-Chi, and I'm honored to introduce him now.
Thank you, Minister Dix, and thank you, Premier Horgan. Good morning, everyone. I'm Dr. Kim Chi. I'm a medical oncologist, researcher, and Chief Medical Officer at BC Cancer, and it really is an honor for me to be here for today's announcement. Premier Horgan and Minister Dix have shared the numbers around cancer, but it bears repeating. 1 in 2 British Columbians will be diagnosed with cancer in their lifetime. And of these cancer diagnoses, lung cancer is the most common and most deadliest. 6 British Columbians will die every day from lung cancer. Prevention and early detection are the keys to changing this statistic. And that is why I'm so pleased to be here today to take part in this groundbreaking First in Canada announcement. By introducing lung cancer screening in British Columbia and linking these efforts with prevention by smoking cessation programs, we can decrease mortality, increase the chance of cure, and improve survival from lung cancer. Lives will be changed because of today's announcement. Cancer research is a big part of what we do at BC Cancer, and lung cancer screening is no exception. Thanks to the leadership of Dr. Stephen Lamb at BC Cancer, who is an internationally recognized leader in the field of early detection of lung cancer, we have been running a clinical trial on lung screening for high-risk individuals for several years, and we are confident we have all the tools we need to successfully implement this province-wide program. Today's announcement has been years in the making, and there are many, many people to thank. While I won't be able to recognize everyone that deserves to be, there are some that I would particularly like to acknowledge. Dr. Lam and his team, and all the people who have participated in the lung cancer screening trial. This is helping us get to today's announcement. All the oncologists and staff at BC Cancer who specialize in treating in lung cancer. I know they join me in celebrating today's announcement. Lisa Kahn, BC Cancer's Executive Director for Screening and Prevention, and her whole team who have developed the plan to implement the lung cancer screening program in the province. The Canadian Partnership Against Cancer, CPAC, who have advocated at a national level for implementation of lung cancer screening. We are proud to stand alongside CPAC as BC becomes the first province to announce an organized lung cancer screening program. The BC Cancer Foundation, who is the fundraising partner of BC Cancer, who have been supporting lung cancer research in British Columbia for decades. They have run a successful program campaign to help fund lung cancer screening in BC. I can't thank enough our foundation and all their generous donors across the province for all they do to help change the outcomes for people facing cancer in BC. And finally, today would not be possible without the leadership and investment of the Government of British Columbia. Premier Horgan and Minister Dix, as a result of their leadership bringing us today's announcement, the lives of many British Columbians will be saved in all the years to come. I'm pleased to be able to introduce our next speaker, Shannon Gall, who will be joining us from her home in Kelowna today. Shannon has lung cancer and currently receiving treatment at BC Cancer Kelowna. She unfortunately could not travel to be here in person with us due to the COVID-19 risk, which is a particular concern for vulnerable populations like those with cancer. Shannon will share a few words about her lung cancer journey, but also how she channeled her energies into raising funds for the lung cancer screening program in BC, all the while going through cancer treatment. As Minister Dix mentioned, Shannon, along with her husband, have raised $1 million for the BC Cancer's Foundation lung cancer screening program. Shannon, our heartfelt thanks to you and your truly inspirational efforts. Over to you.
Thank you, Dr. Chi. My name is Shannon Gall, and I'm calling from Kelowna this morning. I'd like to acknowledge that the land I'm standing on is the traditional, unceded territory of the Syilx Okanagan peoples. I am one of thousands of British Columbians who is currently facing cancer. Just over 2 years ago, I was diagnosed with stage 4 lung cancer. The diagnosis was devastating to our family and came as a shock, as I was only 45 years old at the time, and I've never smoked. I received radiation treatment at BC Cancer in Kelowna and had surgery to remove a large tumor. My biopsy was sent to Vancouver, where a DNA analysis found that I had a genetic mutation called EGFR. I was enrolled in the personalized oncogenomics program and started taking a targeted drug therapy every day. The average stage 4 lung cancer patient only survives a few months, but I'm still here 2 years later. And as every cancer patient with advanced disease knows, every day counts. While I struggled to process why I have lung cancer, I was motivated to do everything I could to make something positive come from my situation. I decided to get involved and spoke at a BC Cancer Foundation luncheon meeting in Kelowna in 2019, where a record-breaking amount of money was raised for genomics research. However, cancer doesn't stop. So when I heard that the BC Cancer Foundation was looking to raise funds to help establish Canada's first province-wide lung cancer screening program, my husband, Clayton Gall, and I decided that we would try to raise $1 million to help launch this initiative. We had met at Phillips, Hager, and North in 1994, and Clayton still works at this BC-based wealth management firm. Most people know it simply as PH&N. Clayton and I made a donation and challenged past and present colleagues to beat or match us. In the first couple of weeks, over $500,000 was raised. Within 2 months, we hit our $1 million fundraising goal and are so grateful to everyone at PH&N for making this happen. The lung cancer screening program will benefit thousands of British Columbians. It could benefit you. It will probably benefit my children, something I am so grateful for. Clayton and I were inspired by people we know who have faced cancer. People in our family, Bob Hager, one of the original founders of PHN, and like every Canadian, we were inspired by Terry Fox and his incredible legacy. I would like to thank Premier Horgan and Minister Dix for inviting me to speak about the advancements in cancer treatment that the government of BC is getting behind. I'm thankful to BC Cancer and the BC Cancer Foundation for changing outcomes for cancer patients in British Columbia. Launching a province-wide lung cancer screening program is going to save lives. I'd like to now turn it back over to Premier Horgan.
Thank you so much, Shannon and Clayton, for your tireless work to make sure that your diagnosis has a meaning for many, many more British Columbians. We're all very proud of you, and you are now the inspiration you talked about in your remarks. So thank you so much, and for thinking about you today. I'm also a cancer survivor, bladder cancer, and it was early detection, early diagnosis that led to positive outcomes for me. This is available to many, many countless British Columbians, but not to many, many others. This lung cancer early detection program will save lives. It will transform families. And I'm so very, very proud of the work that BC Cancer does every single day. But in this instance, to lead Canada yet again, as we did with other cancers, is very inspirational. So thanks, everyone, for participating today. And I'll now turn the floor over to George, and he'll take questions on today's announcement and other issues.
Just a reminder for media participating this morning, please hit *1 to make sure that you're in the queue to ask a question. We will start with Rob Buffum from CTV. Rob, your line is now open.
Okay, thank you. Premier, my question relates to a fall election. As you know, there's been a lot of speculation that there might be a fall election. That speculation is heated up in the past several days. So I guess I'll just ask you point blank, are you going to call a fall election?
Well, as you know, Rob, we are a minority government. We have been for the past 3.25 years, and we've been preparing for the eventuality of an election since day one, and I expect all other political parties have been doing that as well. Today, we're announcing a transformative change in how we diagnose lung cancers in British Columbia that will lead to breakthroughs across the country. Later in the week, we'll be talking about our recovery plan, Minister James and I, and I'm going to continue to focus on the here and the now. What can we do today to make life better for British Columbians? What can we do today to keep British Columbians safe? That's what people have asked me to do, and I'm going to continue doing that.
Follow up, Rob?
Yeah, I guess I'm wondering, you recently, polls indicated that you were the most popular premier in the country. People seem to be approving of the way the government's handled the pandemic thus far. What are your thoughts on, or what do you say to people who would be upset that an election would be called as numbers surged during the pandemic, and do you worry that that would, adversely affect the goodwill that your government has built up and would hurt you at the polls?
Well, again, I just have to respond as I just did, and as I have been since these questions started a few weeks ago. My number one priority is the well-being of British Columbians, and that may well sound stale to the people asking the questions, but it is fresh every day for me. It is a privilege and an honor to have this job. I was on BC Ferries over the weekend, talking to people physically distanced with masks. I have to say that the Transport Canada decision to disregard the pandemic and not grant an exemption to BC Ferries so that we can continue to keep people safe is profoundly disappointing to me. It was a common sense request that was responded to with a rigid answer from Transport Canada. So these are the types of things that matter to British Columbians. That's what I certainly heard over the weekend. Those who have had a cancer diagnosis will very much want to hear about what we're talking about today. Shannon's point that this is a genetic predisposition in her case, everything we can do to help future generations starts today. And that's how I'm, quite frankly, that's how I address every day. I get up in the morning, I come to work, and I do my level best, and I'm going to do that tomorrow and the day after that and the day after that.
Next, we have Tim Ford, Victoria Buzz. Tim, please go ahead.
Thank you very much, Premier. The Green Party will be announcing their leader this afternoon. With regards to your confidence and supply agreement, last week you said, I know that British Columbians want me to focus on 2020 and beyond rather than looking backward to a relationship I had with the then leader of the Green Party and his colleagues. In your view, does the appointment of a new leader change your government's approach to working in the framework of CASA?
No, I wish whoever emerges today as the leader of the Green Party all the best. This is challenging work, and I know that whoever becomes the leader of the Green Party will have a task ahead of them. Again, my job is to work to make sure that British Columbians are safe, that our economy can continue to grow, and that's what I'll be focusing on. I did say last week, and it remains true today, when CASA was contemplated, when it was created, we did not think that a global pandemic was something that we would have to consider. The situation today is not the situation last year, or certainly not 2017. So I have to look at the inputs I get every day, the briefings I get from professional public servants, from the business community, from organized labor, from not-for-profits, all of the component parts of British Columbia. And although the Green Party and the NDP and the Liberal Party and the Conservative Party are part of that fabric, there's much more to British Columbia than the political machinations that we're talking about here. And that's my preoccupation. What do British Columbians need, and how can I deliver on that?
Tim, do you have a follow-up?
Yes, just I know that we're kind of teasing a lot of election stuff today, but I wanted to ask about two high-profile announcements for candidates who are vying to replace Carol James in her riding. First, we've heard from Stephanie Papik, and now today from Grace Lohr. Do you have any thoughts on who you'd like to see taking on the minister in her riding?
No one's taking on. Carol is resigning at the end of this term for health reasons. I will miss Carol James more than I can possibly say, not just because of her extraordinary competence and compassion, but we are dear close friends, and I'm going to miss her greatly. And that's when I think about Victoria Beacon Hill, I think of Carol James. I think everyone thinks of Carol James. She's lived there forever, raised her family, raised numerous other people's children, and that's what I think about when I think of Victoria Beacon Hill. With respect to nominations, all political parties will have to do that. They do that, have in the past, they will in the future, and robust discussion and debate is always best.
Next, we have Richard Zussman, Global News. Richard, please go ahead.
Premier, you didn't really answer Rob's first question, and I know that's by design, but have you come around to the fact, are you comfortable now with having a fall election? Yes or no?
I'm comfortable today announcing a first in Canada. I'm going to be comfortable later in the week talking about our plan to get BC's economy back up and running, focusing on people, focusing on businesses, focusing on communities. Those are my preoccupations, and I realize that what I say will either stoke or dampen speculation, but I've answered this question many, many times. We've always been ready for an election campaign, and I'm going to just keep working until that time arrives.
Follow-up, Richard?
On education, we have smoke here in the southern Vancouver Island and in Metro today, and the DCTF sent out a tweet saying that teachers should stay home if they're concerned about the smoke and about the precautions around COVID that often call for kids to go outside. Like, are you concerned about the TF asking members to stay home and what sort of disruption this could have on the school system?
Well, those decisions are made by local authorities. We have elected school boards who have superintendents of education. They have administrators in classrooms, in schools across the province. It's not just the island and the Lower Mainland that are affected by the poor air quality today. And I believe that just like a snow day, those are local decisions. And I would leave it to those people who deliver the education service, who have employees, teachers, support staff, and others, that they'll make those decisions based on the best interests of their communities. And that's as it should be. I would also add, well, that we're on the subject of air quality, I want to say that we currently have 40 British Columbia wildfire fighters in the United States just south of Grand Forks, working hard to control fire there. Another 208 are ready to deploy in the coming days. They'll be going to Washington and Oregon, and another 200 are ready to deploy over the next 10 days. And I want to raise this because over 800 volunteers put their hands up to run into someone else's community, someone else's fire, to do what they can to make sure that people are safe. And that just is extraordinary in my mind. My brother was a 35-year professional firefighter. I know what impact that has on families when there is a major fire, as we had on the docks on the waterfront in New Westminster overnight. So firefighters are so precious to us, and that 800 British Columbians said, how can I help? How can I go to the United States to keep people safe? I think speaks volumes about our compassion and our commitment to helping each other. I'm very proud of those individuals, and I'm proud of all British Columbians banding together in these very difficult, extraordinarily difficult times.
Next, we have Mary Brooks. Mary, your line is now open.
Thanks. Hi, Premier. I'm looking at the expression of condolences and so on across the country about Ellen Chrétien passing away on the weekend, and looking at the idea of how women are influential in politics. And in your government, you've made a point of having 50-50 in the cabinet and so on, and encouraging women to run for politics. And what we're looking at in the case of Ellen Chrétien is someone who worked behind the scenes. So I'm just sort of wondering if you have a comment in all of that light on women in politics going forward.
Well, thank you, Mary, for the question, and certainly my condolences go to the Chrétien family. A loss of a woman who was behind the scenes, as you say, for decades, working on behalf of Canadians. I know I could not do what I do without my wife, Ellie. I just couldn't. And so I can't speak to the importance of family when it comes to politics, but I can speak to the importance of having women participate in the front lines of politics. And I'm very proud that not only are half of my cabinet colleagues men, half of them women, but the NDP caucus is fully half men and half women. And it's also diverse in terms of orientation and diverse in terms of ethnic background and religious beliefs. And I believe that the reflection of British Columbia, the reflection of Canada, should be in all of our public institutions, not just elected bodies, but our professional public service, law enforcement, first responders. All of our institutions should be as diverse as the communities that they represent. And I think that people like Ellen Chrétien, who has sacrificed so much to the fabric of Canada, needs to be recognized, and grateful thanks to her for her lifetime of serving Canadians with her husband and her family. And she'll be greatly missed, I know, by the Chrétiens. And it reminds us all that when we see political leaders, whether they men or women, in front of cameras as I am today, I couldn't have got here this morning without Ellie getting me out the door. And I know that sounds trite, but there's a whole lot more to getting out the door, as everyone knows, when you're going to work, whatever you may do. And I just could not do this without her.
Mary, do you have a follow-up?
Yes, because of the COVID economic impact, they are saying that women have fallen behind by about 30 years in terms of having access to working in the economy, partly because of lack of childcare right now, and also because most of the sectors hit by COVID are where women are predominantly employed. So I'm just wondering what your government is doing to make sure that women don't fall too far behind during COVID.
I'm not sure about the 30-year variable that you put there, Mary, but I absolutely know that women have been disproportionately affected by the pandemic in terms of their the workforce. But also, we have, since we formed government over 3 years ago, have made childcare a high priority. In fact, among our highest priorities, because it is not just about caring for children, critically important as that is, it's about ensuring that everyone can participate in the economy. With increased costs, it's important that there be oftentimes absolutely essential that there be two incomes to keep food on the table and to keep the rent or the mortgage payments going. And fundamental to that is childcare. And what we've seen during the pandemic is that childcare is critical. It's an essential service and vital to our functioning as a society. So I believe that we're going to continue. I know we're going to continue to invest heavily in making sure there are more childcare spaces. We're training more early childhood educators and a host of other initiatives to make sure that women can fully participate in the workforce. Women in trades is an area that I know my colleague Melanie Mark is always focused on. Community benefit agreements, which we put in place for some capital projects like the Patella Bridge, the Broadway SkyTrain line, as well as Highway 1 east of Kamloops, is designed to make an opportunity for women to get into the trades, non-traditional activities. I was visited with some electricians over the weekend in Vancouver, and women in the trades is a key part of democratizing our workforce and making sure that all members of the community can participate. And we're going to continue to focus on that, because not only is it the right thing to do, it's better for our economy that everyone participate and people realize their full potential, getting the skills they need to be full participants.
And lastly, we have Andrea Ross, CBC. Andrea, please go ahead.
Hi, this is a question for Dr. Kim Chi. I'm not sure if he's still on the line. Obviously, everyone's concerned about the air quality right now with so much smoke from wildfires, and considering lung cancer is already such a prevalent and deadly disease, do you anticipate rates of lung cancer and other respiratory problems increasing as a result of more severe and longer wildfire seasons in Canada and the U.S.? And then, to follow up on that, perhaps for Premier Horgan, is BC's healthcare system prepared for the costs and other impacts this could have?
So air quality, air pollution have been related to cancers, including lung cancers, as well as other pulmonary ailments. And so, yes, as global warming and global climate changes occur, these will be problems for the future. However, I think today's announcement around lung cancer screening is an important part of early detection and preventing and detecting cancers at an earlier stage, where we can have increased chance of cure and improved survival.
Thank you, Dr. Chi. And I would just add to that, of course, we are building into everything we do in government through our Clean BC initiative and addressing climate action here in BC, that we're putting the resources in place to not just reduce emissions, but to adapt to the new environment that we will all be working in. What we know with absolute certainty is that as our climate changes, we're going to see more wildfire seasons as we've had over the past number of years. We're going to see more harsh winters and more intense summers, not just here in British Columbia, but globally. That's going to have an impact on supply chains, on our food production, and that's why, as we talk about climate change, it's not just about emission reduction, as fundamental as that is. Without that, we have no success. But we also have to build an economy. We have to build our social infrastructure so that we can adapt to the future that we are going to inherit and that we're passing on to our future generations.
Andrea, do you have a follow-up? Okay, thanks very much, everyone.
Thanks, everyone.